people of St. Martin, both here and abroad, I hereby address you as the Prime Minister of St. Martin and EOC Chair for today's update April 9th, 2020. As part of the process to keep the community updated as to our latest COVID-19 containment, mitigation, and response measures, as well as to give you the update on our data. A strategic meeting was held with the EOC yesterday on April 8th, and this morning on April 9th, the disaster management team comprised of ESF 4 and the back office met with ESF 6, the health section, to strategically plan for the rollout of the dashboard and the use of the data in planning and execution of our mitigation strategy, especially during this lockdown. Later in the evening, in the afternoon today, ESF 5 was also on the table to discuss how the update is going with the controls as well as public order during the lockdown. I would like to update on the COVID-19 cases for today, April 9th, which are as of 4 p.m. this afternoon. Self-quarantine, 133. Self-isolation, 203. Number tested, 134. Number positive, 50. So we've gone up as we've gotten all those pending except for one. 50 positive, of which 2 are hospitalized. 34 of the positive are males, while 16 are females, and the number that have tested negative are 82. The number that still is pending is 1, and 1 test was inconclusive, so that will have to be redone after a period of time. As we all know, we have had 8 persons who have died and have been tested positive for COVID-19. As I explained yesterday, 2 of these persons did not actually die of COVID symptoms, but died due to other underlying circumstances that they were dealing with at the time. We have now recorded that 3 persons have recovered. As such, there are 39 active cases, of which 2 are in hospital and 37 are recovering at home or in our isolation facility. We wish to encourage all those currently still suffering with the virus to remain indoors, to remain isolated, to protect your families, and for those caring for them to also utilize strict hygiene and follow the directions of CPS and your general practitioner, your house doctor. The next point I'd like to update on is basically the meeting we held today regarding the use of data. The EOC COVID-19 dashboard to record data and statistics is being developed, is being fine-tuned, and this will better allow us to be able to mitigate our response as well as all the launching that we will be doing in the coming weeks. This dashboard will be launched in the coming week. Data is being digitalized in order to facilitate CPS in its response to COVID-19 to monitor and report progress of efforts, as well as to provide empirical data to support decisions to be taken by the EOC. Especially during this lockdown period, this is very, very important as we must be able to see how our efforts are panning out. Dashboard for the public is also being worked on, which will be a one-stop shop for all info that is COVID related, which will be updated daily. So the public will be able to go to this site, see the data, see the changes, see the graphs, etc., as well as everything related to COVID, including our stimulus plan and all of the press briefings and statements that have been made. Also important to know is that the delivery program that is being carried out at the moment, as well as closures in connection with the holidays. Orders from the public must be submitted to the respective grocery stores between 8 a.m. and 10 a.m. This has been implemented because many are complaining that they have made orders and have not received it. One must remember that this is a very new operation for all our grocery stores, at least most of them. They are not used to this, and as such, we must adjust to the new situation. Seeing that we were actually going to have 2 weeks of a total lockdown, we should actually be very grateful that we can order necessities and not waste persons' time ordering frivolities. This situation has been organized more specifically for those who had not been able to purchase food, as well as for those who are not able to purchase food in bulk for the 2-week period, to allow them to be able to purchase on a smaller scale. I am therefore asking all to cooperate, to be amicable, to be friendly, to be understanding. Everybody's under pressure, but this is a service that is being provided to you. So we ask everyone, both serving as well as ordering, to be patient. So orders should be made as of today, so from here on in, from 8 a.m. to 10 a.m. This way, the grocery store will have a load that they can handle. Groceries, both large and small, the smaller ones will also be opening, will have the opportunity to deliver between 8 a.m. and 4 p.m. Between 4 and 6, the employees and the businesses can work on packaging items for the next day delivery. Each grocery store operator needs to ensure that a priority system is implemented to ensure that priority is given to orders of the basic necessities. Yes, I'm seeing people asking. Yes, all of the supermarkets, most of them are on board, and many have gotten their waivers signed off today. I would like to discourage persons who think that they can go to the grocery store and walk in and order food, even if the store owner has told you such. This is strictly forbidden. The lockdown is for a main reason to keep everyone safe at home so that we can properly go out, identify, isolate, and test those who may be COVID positive. This is to avoid further spread. And if we use every opportunity to get on the road, you are therefore thwarting every effort for us to be able to do so. All purchases and orders should be on a strict need basis only. Also, government through its ESF 7 is busy with deliveries to the vulnerable. I have been talking about this for the past week, and as of Monday past, many persons, over 400 persons, have received boxes. I want to thank all the frontliners who are working tirelessly to do this, despite the negativity within the community that they are facing. Several persons are trying to steal or attack these persons. I cannot believe the stories that I'm hearing. This is food that the government of St. Martin has procured, has bought, and is distributing to persons on their list. Several persons have registered on the social impact assessment form. Those persons will not be receiving in this first go around, but will be in the next go around. So please be patient. We are going through your forms, assessing those with acute needs, and will be dealing with those as soon as possible as well. Pensioners are also included on that initial list, as well as those persons who were being served by soup kitchens, by the senior citizen recreation, as well as others on our list, whether it's SEAB, Voogdijraad, foster children, and all those who social services and the other community services are aware of. We are compiling the data that has been presented. There are over 4,000 persons who we still would have to serve that have registered, and I ask that you be patient. Many persons are calling me and asking how they can help such persons, and the only way that I can say at this moment is that you put in an order and have it delivered to their homes. Do not venture out yourself to deliver food. So the persons who have been registered, you will be handled in the coming week, and it is not expected that you would, upon registering today, expect that a delivery would be made tomorrow. Those persons who are on our list should ensure that they are actually living at the home whereby they are registered with community services and social services. Testing will continue in our efforts to mitigate the spread. CPS will be going out into the community with many volunteers to test, isolate, and contain the spread of the COVID-19 virus. Those persons in vulnerable situations where isolation is not possible will be isolated in our facility to further mitigate the spread as well. We also continue with weekly consultations on a ministerial level, as well as with prime ministers, ministers of health within the kingdom, and also with the Minister of Bezetka, that is Binnenlandse Zaken, Interior and Kingdom Relations. I would like to thank all the ministers of health for their cooperation and support in getting the much needed equipment and medical personnel for St. Martin. I am assured that they are being well taken care of, and we are ready to deal with any outbreak that may happen on a medical level at this moment. I was still able to update our Kingdom partners on some of the bottlenecks we still experience, whereby the number of test kits, etc. is concerned, and we have been promised assistance where this is concerned as well, and we look forward to that. Our Ministry of Interior and Affairs has also reiterated, we have reiterated to them yesterday in a meeting that we would prefer a grant instead of a loan, as our liquidity support from since our after effects of hurricanes Irma and Maria is already a loan, and the CFAT and the CAFT, even though they have advised that this should be the case, our Caribbean members on the CFT and the CAFT do not agree and believe that the Caribbean islands should be given the opportunity to have a no strings attached form of liquidity support in order to deal with this COVID experience. We have the Kingdom Council of Ministers met today, and I was updated that indeed the liquidity support for 2019 has been transferred and has been received by the Central Bank of Curaçao and St. Martin. This is not liquidity that is related to COVID-19. That request is still being handled and is more of a 245 million over 3 months to assist not only persons who have lost their jobs, but businesses to be able to keep their employees, those who are suffering, as was explained by the Minister of Finance yesterday, as well as persons who are on the social list. Before that kicks in, as I mentioned in yesterday's briefing, we will be instituting a voucher program to also assist those who are in need of food. Several persons have complained that it has been difficult to cross to the French side. I would like to reiterate that both French and Dutch St. Martin are working together on the controls and are utilizing the same form for cross-border movement. That is on the Dutch side, Form C, and the French side are using the exception, the form of exception. Both of them are exceptions. They are the same form actually. The French form will be signed by the Préfet, and the Dutch form signed either by Minister Panafleck, myself, or Carl John. Some are also being signed by Minister Richardson of Justice. Those forms are valid for both sides. So if you are on the Dutch side and you have the Dutch form, you're allowed to go to the French and come back as long as it is allowed for work or for medical purposes or other urgent matters that cannot wait. You are not allowed to be on the road for no reason, just to go sightsee or just to visit someone that you miss. It must be an emergency or that you are key to the care of an elderly or vulnerable person. The Justice Minister has sent forth a request, which is corroborated by us, for more maréchaussée, Kingdom maréchaussée, to assist the police. Some had left a few weeks ago, and this request is being processed. We expect that we will have some more assistance on the ground to assist our police force in keeping law and order. Any abuse of the waivers will not be tolerated, and the inspectors of businesses as well as police will inspect, and if violations are found, any stores violating will be shut down and fined. There is also a great concern from our police department that even though many people, let's say 80 to 90%, are adhering very strictly to the shutdown rule, there are still youngsters within the community who are behaving very dangerously on motorcycles, and we have seen that there has been a serious accident on the front side earlier today. So I'm really asking all parents, keep your children at home. It doesn't matter how old they are. Everyone is expected to stay inside. There should be no hanging out in groups under trees, outside of supermarkets or outside of any other buildings, in yards or any sort of gathering whatsoever. All are expected to stay at home, stay within the confines of your yard, and avoid as much as possible gathering. Someone has asked, can I take my garbage down to the bin? Yes, of course. You may take your garbage down to the bin. You may walk your dog if you do not have space within your yard, or if you only have concrete in your yard. However, you are not allowed to be all over the place, within a short distance from your home for these types of movements and for nothing else unless it is urgent. That includes, urgent things include appointments at the doctor for chronic illnesses, taking care of the elderly, getting medication, but even though I think that isn't necessary, as pharmacies are also delivering medication. Before closing, I would like to remind the people of St. Martin why we are doing this. We are facing a pandemic of worldwide proportions. Everyone, and I mean everyone, is feeling it all around the world. We must do our part as citizens of St. Martin to curb the spread of this virus. Yes, I suspect that there are more persons who are infected out there. The majority may be asymptomatic, but the minute you start showing symptoms, you are then a liability to the persons around you. So I again ask each and every one, if you have any symptoms whatsoever that are COVID related, therefore coughing, cold-like symptoms, flu-like symptoms, and you're running a fever, please call 914 and register. Call your doctor, your house doctor, your family doctor, whatever you prefer to call him or her, and notify him. The doctors are also helping us, now that we've received PPEs, to assist in swabbing their patients and following up to ensure that they are doing well while isolating at home. Those in quarantine are also asked not to venture outside. In fact, we are all now in quarantine. So please, do your duty, stay inside, take care of your family, spend lots of time with them, doing all the wonderful things that there is now to do. You have internet, you have life. Enjoy it with your family. You are safe at home. It is the Easter weekend, and I know that many are used to going to the beach, enjoying time with family, and we know that we will have to celebrate differently this year. So I'm asking each and every one of you to please take your time, pray, reflect, be thankful for what we have. Let us make do with what we have to avoid being on the road unnecessarily or having the delivery persons out there unnecessarily. It is a difficult time, but we are a strong people and we will get through this together. We as government are doing everything within our power to ensure that people of St. Martin are safe, but you as people must do what it takes to keep yourself safe as well. Tomorrow is Good Friday. It is a holiday, a national holiday. As such, no deliveries will be made, nor on Easter Sunday. So I'm hoping that if you have and your neighbor doesn't have, that you would share. Yes, that is still allowed. We expect each and every one to behave as good citizens of St. Martin and ensure that people are happy, healthy, and safe. Yes, the supermarkets can take up to 2 days to deliver. However, I'm hearing around the world that it is taking 2 weeks to deliver. Sometimes perspective is everything. For those with religious and spiritual beliefs in our community, I call on you to pray. I call on you for a moment of silence for the dearly departed, those from COVID and those that are not COVID related. Every life is valuable, and we hope to be able to save more lives as our days go by. Tune in to our government Facebook pages, our website for more information. Continue to spread the love that I'm seeing going out there to encourage others to keep up their good spirits. Remember, the resilience is not something that we got overnight. It has been handed down by the ancestors, and this too shall pass. I would like to wish each and every one a happy Easter. In as much as we are confined, we are in our homes. Share love through social media. Share caring through social media. Share with your neighbors if you have food. And pray. Pray that the effects of the COVID-19 virus is less than what we would expect. That what we will find in going out with the communities is less than what would be expected. And that we will quickly be over with it and move forward. Do not go to the beach. Do not go out. Stay at home. Say your prayers. Eat what you have. Play with your family. Laugh with your family. And on Tuesday, God Spare Life, then we can look forward to resuming at least the deliveries and moving forward with our lives in this new COVID-19 reality. God bless you, people of St. Martin. God bless each and every one of us as we reflect and think about this serious season that we are now in. Happy Easter all.